Fennel seeds have been used for centuries as a powerful spice and medicinal herb, praised for their potential health benefits. They are rich in essential nutrients, antioxidants, and bioactive compounds that contribute to various health benefits. However, many people do not know the optimal ways to use fennel seeds to maximize their benefits and avoid potential side effects. In this video, we will explore the incredible health benefits of fennel seeds and how they can transform your health. We will also discuss the correct ways to consume fennel seeds to ensure you gain all their advantages without making common mistakes. In the meantime, if you already consume fennel seeds, share with us how you consume them in the comment section below. Fennel seeds are small, aromatic seeds with a taste similar to anise. They are derived from the fennel plant, Feniculum vulgare, which is native to the Mediterranean but is now cultivated worldwide. Fennel seeds are used extensively in cooking and traditional medicine for their digestive and carminative properties. One of the most remarkable qualities of fennel seeds is their ability to act as a potent antibacterial and anti-inflammatory agent, effective against various diseases caused by bacteria and inflammation. Research has shown that fennel seed extracts can combat harmful bacteria, including those that cause gastrointestinal infections and respiratory issues. Now let's answer the important question. What is the best time to eat fennel seeds to reap the maximum benefits? To reap the maximum benefits of fennel seeds, it is essential to consume them at the right time. The best time to eat fennel seeds is after meals. They can help stimulate digestion, reduce bloating, and alleviate gas. Consuming fennel seeds on an empty stomach in the morning can also boost metabolism and promote overall digestive health. Fennel seeds contain natural compounds that enhance digestion by promoting the secretion of digestive juices and enzymes. This makes them an excellent choice for post-meal consumption. Additionally, their natural sweetness makes them a perfect ingredient for teas and desserts. Fennel seeds have been traditionally used to treat various digestive issues. They can help relieve bloating, gas, and indigestion. Fennel seeds contain compounds that relax the smooth muscles of the gastrointestinal tract, reducing cramps and discomfort. Their carminative properties make them effective in expelling gas from the intestines, thus relieving bloating. Fennel seeds are rich in antioxidants, which help combat oxidative stress and inflammation in the body. These properties are beneficial in reducing the risk of chronic diseases such as heart disease and cancer. The essential oils in fennel seeds, particularly anethole, have shown significant anti-inflammatory effects. Women have used fennel seeds for centuries to alleviate menstrual cramps and regulate menstrual cycles. Studies suggest that fennel seed extracts can reduce the intensity of menstrual pain by relaxing uterine muscles and acting similarly to pain relief medications like ibuprofen. Despite the many benefits of fennel seeds, some people make certain mistakes when consuming them, especially if they have underlying health issues. Here are some common mistakes to avoid. 1. People with allergies. Fennel seeds, while beneficial for many, can pose significant risks for individuals with allergies. These seeds contain compounds such as lipid transfer proteins, LTP, and profilins, which are known allergens that can cause allergic reactions in sensitive individuals. These proteins are also found in other plants within the Apiaceae family, such as celery, carrot, and parsley. This cross-reactivity can lead to allergic reactions in people who are already allergic to these plants. The most common symptoms of fennel seed allergy include oral allergy syndrome, OAS, which manifests as itching or swelling in the mouth, lips, throat, and tongue shortly after consuming the seeds. Other symptoms may include hives, gastrointestinal discomfort, and in severe cases, anaphylaxis, which is a potentially life-threatening condition that requires immediate medical attention. Fennel seed allergy is often linked to celery mugwort spice syndrome, a subtype of pollen food allergy syndrome. This syndrome occurs in individuals sensitized to pollen, particularly mugwort, and can result in allergic reactions to foods with similar protein structures, such as fennel. Symptoms can range from mild oral reactions to more severe systemic reactions. Individuals with known allergies to plants in the Apiaceae family, such as celery and carrot, should exercise caution when consuming fennel seeds. It is advisable to consult with an allergist for specific testing to confirm fennel seed allergy. For those diagnosed with this allergy, avoiding fennel seeds in both raw and processed forms is crucial. Alternatives include using fennel bulbs and fronds, which typically do not contain the allergenic proteins found in the seeds. 2. Pregnant and breastfeeding women. Fennel seeds contain phytoestrogens, which mimic estrogen in the body. While these compounds can be beneficial in some contexts, they pose risks during pregnancy. The phytoestrogens and other active compounds in fennel can stimulate uterine contractions, potentially leading to premature labor or miscarriage. This effect is due to the antispasmodic and estrogenic properties of fennel, which can increase menstrual flow and stimulate the uterus. Given these potential risks, it is generally advised that pregnant women consume fennel seeds in very small amounts, if at all. The small amounts typically found in food, such as in salads or as a spice, are usually considered safe, but medicinal doses or concentrated supplements should be avoided. Always consult a healthcare provider before incorporating fennel into your diet during pregnancy. For breastfeeding women, fennel seeds are traditionally used as a galactagogue, a substance that increases milk supply. The phytoestrogens in fennel can help boost the production of prolactin, the hormone responsible for milk production. Some studies suggest that fennel can enhance milk volume. However, there are mixed results regarding its effectiveness. While some mothers may experience increased milk supply, others may not notice a significant difference. Moreover, fennel's active compound, anethole, can be transferred to the baby through breast milk. There have been reports of toxicity in infants when mothers consumed large amounts of fennel tea. Symptoms improved after the mothers stopped consuming the tea, indicating that excessive consumption can be harmful. It is important for breastfeeding women to use fennel seeds in moderation and under the guidance of a healthcare provider. Small amounts used in cooking are generally safe, but larger medicinal doses should be approached with caution. 3. People with sensitive stomachs. While fennel seeds can aid digestion by reducing bloating, gas, and spasms in the gastrointestinal tract, they can also pose certain challenges for those with sensitive digestive systems. Fennel seeds are effective in relieving digestive discomfort. They help by relaxing the muscles in the gastrointestinal system, promoting smoother digestion, and reducing symptoms like bloating and gas. The seeds stimulate the production of digestive enzymes and bile, which enhance nutrient absorption and overall digestive health. These properties make fennel seeds a common remedy for conditions like irritable bowel syndrome, IBS, and heartburn. However, the high fiber content in fennel seeds can sometimes be problematic for people with sensitive stomachs. Excessive fiber intake can lead to digestive discomfort, including bloating, gas, and even constipation. This occurs because fiber adds bulk to the stool, and if the digestive system is not accustomed to high fiber levels, it can become overwhelmed. To mitigate these issues, it is recommended to consume fennel seeds in moderation. Starting with small amounts and gradually increasing the intake allows the digestive system to adjust without causing excessive discomfort. A typical serving size is about half a teaspoon of fennel seeds, which can be chewed after meals or brewed into tea. Another strategy to reduce digestive discomfort is to combine fennel seeds with other easily digestible foods. This can help balance the meal and reduce the load on the digestive system. For instance, adding fennel seeds to a light salad or incorporating them into a smoothie with low-fiber fruits can provide the benefits of fennel without overwhelming the stomach. It is also crucial to drink plenty of water when consuming high-fiber foods like fennel seeds. Adequate hydration helps the digestive system process fiber more efficiently, reducing the risk of bloating and constipation. Ensuring you are well hydrated can significantly enhance the digestive benefits of fennel seeds while minimizing potential discomfort. 4. People with kidney issues. People with chronic kidney disease, CKD, need to be particularly cautious when consuming fennel seeds due to their potential effects on kidney health and the management of kidney function. Fennel seeds naturally contain sodium and potassium, minerals that can pose significant risks for individuals with CKD. Patients with CKD often need to restrict their sodium intake to prevent fluid retention and manage blood pressure. Excessive sodium from fennel seeds can exacerbate these issues, leading to complications such as hypertension and fluid imbalance. Potassium is another critical mineral found in fennel seeds. While essential for muscle and nerve function in healthy individuals, excessive potassium intake can be dangerous for CKD patients. Impaired kidney function reduces the ability to excrete potassium effectively, leading to hyperkalemia, a condition characterized by high potassium levels in the blood. Hyperkalemia can cause severe cardiac complications, including arrhythmias and even cardiac arrest. Fennel seeds can interact with certain medications, which is a crucial consideration for CKD patients who often take multiple drugs. For instance, fennel seeds may increase the risk of bleeding when taken with blood-thinning medications, such as warfarin. Additionally, the diuretic properties of fennel seeds can potentially interfere with other medications by altering their absorption or efficacy. To safely incorporate fennel seeds into their diet, CKD patients should consume fennel seeds in moderation. A safe intake might be about 1 to 2 teaspoons per day, but this should always be discussed with a healthcare provider to tailor the advice to individual needs. Regular monitoring of kidney function, including sodium and potassium levels, is crucial for CKD patients. This allows healthcare providers to adjust dietary recommendations as needed to ensure safety and prevent complications. CKD patients should always consult with their healthcare provider or a registered dietitian before adding fennel seeds or any new supplement to their diet. This helps to evaluate potential interactions with medications and to develop a personalized and safe dietary plan. Every CKD patient has unique dietary needs and restrictions. Working with a healthcare provider to develop an individualized approach ensures that all nutritional requirements are met without compromising kidney health. Now tell us, how often do you consume fennel seeds, and which of these mistakes about fennel seed consumption surprised you? Share your thoughts in the comments below. We'd love to hear from you. To learn more about the benefits and side effects of fennel seed, click on the video showing on your screen right now.